If you're undergoing surgery, you could be at risk for one of the most common complications after surgery. This video might be has everything you need to know about it, so take a look.
I've thought, what happened after the surgery? Normally, after surgery, I can kind of remember being in the recovery room or maybe being moved into a bed, and I don't remember that at all. And I thought, why don't I remember? She said, oh, we were laughing and giggling. She said, you were saying the silliest things. And I said, well, what did I say? And they said, well, you were talking about somebody next door. And they couldn't figure out whether it's in the next room or somebody in the apartment next door to me. And then seeing these little people over in the corner, that I don't remember at all. Probably just as well.
Delirium is a state of altered mentation or thinking, where one experiences a degree of confusion. And this confusion tends to fluctuate throughout the course of the day. So a person who's suffering from delirium can appear terribly confused at one point during the day and then very coherent at yet another time during the day. Delirium has many causes. But it's important to realize that there are two fundamental requirements in order to experience a bout of this ailment. The first is that there has to be some underlying brain illness that places a patient at risk for a bout of confusion. This underlying illness can, again, be many, many things. Neurodegenerative brain illnesses like Alzheimer's disease or Parkinson's disease, stroke, head injury. Many things can lead a patient to be susceptible to having a bout of confusion. Once one has an underlying susceptibility, there needs to be a trigger. There needs to be an acute stress event that then produces a state of delirium. And these acute stress events also are varied. Medical illness, trauma, surgical illness, medicines, many, many things can trigger a bout of delirium in a patient who's susceptible to have the illness.
Delirium occurs in about 20% of patients in the hospital. The numbers are higher for older adults, people who are medically ill, people who are having surgery, and especially people in the intensive care unit.
Basically, there are three types of presentations that delirium can cause in a hospital-type setting. The first is an overly sedated type presentation where somebody is very tired or can't even keep attention to a conversation that you're having more than a few moments, may drift in and out of sleep, so they can't follow information. Of course, they can't remember stuff later on. A second one is where they're a little more disinhibited. Their filter is gone, if you will. So socially acceptable behaviors might fall by the wayside. So they might become easily angered or inappropriate in their behaviors. And when it gets really bad, it can even lead to sometimes aggressive behaviors and violent behaviors. And in a hospital setting, that can lead to dangerous situations for the patient and others. And a third presentation that a lot of families will see is a fluctuation between the two, where somebody is overactivated at one moment and maybe after an hour or two is now activated. And so that they go from being really involved with stuff and just kind of obnoxiously behaving all the way down to where they are not even interacting at all in the matter of the day.
After delirium develops, doctors and nurses carefully try to identify either the causes of delirium or things that are contributing to delirium. Common things that cause or contribute to delirium are new medications. So for example, medications that are started after surgery, medications that are started to treat medical illnesses. Other things they'll look for are electrolyte problems, low oxygen in the blood, or other sorts of medical issues that could be confusing the patient.
The nurses are going to want to look for nonverbal signs of pain, which can cause agitation in patients. So they'll look for guarding and grimacing, resistance to cares, and maybe trying to avoid narcotic type drugs and give plain Tylenol instead for pain. Try to avoid sedating drugs that help patients sleep, because these can also increase confusion. So they'll try to avoid, the lorazepam or diphenhydramine type drugs, which are Ativan or Benadryl. To have the shades open during the day to help keep the patient awake and more active during the day.